Intermittent fasting explained. Is it really safe? In recent years, intermittent fasting has gone from a niche diet trend to a mainstream health strategy embraced by celebrities, fitness influencers, and doctors alike. But what exactly is intermittent fasting? At its core, intermittent fasting, often abbreviated as IF, isn't a diet in the traditional sense. It's an eating pattern that cycles between periods of fasting and eating. Unlike typical diets that focus on what you eat, intermittent fasting focuses on when you eat. There are several common patterns of intermittent fasting. The 16-to-8 method, for example, restricts eating to an 8-hour window each day, typically from noon to 8 p.m. Another popular version is the 5-to-2 approach, where individuals eat normally for 5 days of the week, but limit their calorie intake to about 500 to 600 calories on 2 non-consecutive days. But as with all health trends, popularity doesn't guarantee safety. That leads to the crucial question: is intermittent fasting really safe for everyone? To answer that, we have to dig into the science behind fasting, the benefits, the risks, and who should approach it with caution. But before we dive in, make sure to smash that like button and subscribe to the channel so you never miss out on our upcoming videos. Now, let's get started. How intermittent fasting affects the body. When we eat, the body spends several hours processing and digesting food, especially carbohydrates, which are converted into glucose and used for energy. During this fed state, insulin levels are elevated, and the body stores excess glucose as fat. When we fast, insulin levels drop, and the body is forced to turn to stored fat for fuel. This metabolic switch is believed to be the foundation of many of fasting's benefits. Fasting triggers several hormonal changes. Insulin levels go down, which helps with fat burning. Human growth hormone levels may increase, which can promote muscle gain and fat loss. There's also an uptick in norepinephrine, a hormone that boosts metabolism. On a cellular level, fasting stimulates autophagy, a process where cells remove damaged components and regenerate. This process has been linked to anti-aging effects and a lower risk of certain diseases. Weight loss and metabolic benefits. One of the most touted benefits of intermittent fasting is weight loss. By shortening the eating window, people naturally tend to consume fewer calories. Combine that with hormonal changes that support fat burning, and the results can be impressive. A 2015 review published in Molecular and Cellular Endocrinology found that intermittent fasting led to 3 to 8% weight loss over 3 to 24 weeks. Waist circumference, a marker of belly fat, also decreased by 4 to 7%. Beyond weight loss, intermittent fasting shows promise for improving insulin sensitivity and reducing blood sugar levels, especially in people with prediabetes or type 2 diabetes. Some trials have also observed reductions in inflammation, cholesterol levels, and blood pressure, all major risk factors for heart disease. Is intermittent fasting safe for everyone? Despite the potential upsides, intermittent fasting isn't a one-size-fits-all solution. While many healthy adults can safely practice it, certain groups should proceed with caution or avoid it altogether. People with a history of eating disorders such as anorexia, bulimia, or binge eating should avoid intermittent fasting. The restricted nature of fasting can trigger disordered eating patterns and negatively impact mental health. Similarly, individuals with anxiety or depression should approach fasting with care, as the drop in blood sugar during fasts may worsen mood or energy levels in some cases. Pregnant or breastfeeding women need more calories and nutrients to support fetal and infant development. Restricting food during this period can interfere with the baby's growth and the mother's health. For that reason, fasting is generally not recommended during pregnancy or while nursing. Children and teenagers are still growing and require steady nutrient intake throughout the day. Intermittent fasting is not appropriate for young people unless specifically advised and monitored by a medical professional. For people with diabetes, especially those on insulin or blood sugar-lowering medications, fasting can be risky. It may cause hypoglycemia, a dangerous drop in blood sugar. However, under medical supervision, some individuals with type 2 diabetes have successfully used intermittent fasting to reduce insulin dependence and improve glucose control. Lastly, those with chronic conditions or on medications should always consult a healthcare provider before starting intermittent fasting. Drug absorption, nutrient interactions, and individual metabolism vary widely, and fasting could alter how medications work. Side effects and challenges. Although many people adapt to intermittent fasting after a short adjustment period, some experience side effects, especially in the early days. Hunger is the most common challenge. It may be intense at first, particularly during usual mealtimes, but many report that hunger decreases over time. Others may experience fatigue, headaches, irritability, or difficulty concentrating. Staying hydrated and consuming adequate electrolytes can help reduce these symptoms. Another potential downside is nutrient deficiency. If your eating window is narrow and meals are poorly planned, you may not get enough essential vitamins and minerals. That's why focusing on nutrient-dense foods like fruits, vegetables, whole grains, healthy fats, and lean proteins is crucial. Social and cultural aspects of eating can also make intermittent fasting difficult. Family meals, gatherings, or work schedules might not align with fasting hours, leading to missed events or stress around food. Some people, especially athletes or individuals with high physical demands, may find it hard to meet their energy needs within a limited eating window, which can impact performance and recovery. Does intermittent fasting work better than traditional dieting? Intermittent fasting isn't necessarily superior to traditional calorie-restricted diets in all cases. Studies comparing intermittent fasting to daily calorie restriction show that both methods are effective for weight loss and improving metabolic health. The main difference lies in sustainability and personal preference. Some people find fasting easier to maintain because it simplifies meals and eliminates the need to count calories constantly. Others may struggle with long fasting periods and feel more comfortable eating smaller meals more frequently. The best diet is the one you can stick with long-term without compromising your health or happiness. Debunking the myths. There are a few persistent myths surrounding intermittent fasting that deserve clarification. One common belief is that skipping breakfast slows down metabolism. While breakfast can be a healthy part of your routine, skipping it does not inherently damage metabolism. In fact, fasting can temporarily increase metabolic rate due to the rise in norepinephrine. Another myth is that fasting causes muscle loss. While muscle loss can occur during weight loss regardless of the method, studies show that intermittent fasting, especially when combined with resistance training and adequate protein, can preserve muscle mass just as well as other diets. Lastly, some people worry that fasting puts the body into starvation mode, slowing weight loss. Starvation mode does exist, but it typically occurs after prolonged, extreme calorie restriction, not during short fasting windows like 16-8 or even 24-hour fasts once or twice a week. Long-term effects and emerging research. As promising as intermittent fasting seems, long-term data is still limited. Most studies have been short to medium-term, lasting a few weeks to several months. While early evidence supports the safety and effectiveness of EF, more research is needed to assess its impact over many years. Researchers are currently investigating how fasting may affect aging, cancer risk, and neurodegenerative diseases. Early animal studies suggest that intermittent fasting could extend lifespan and delay age-related illnesses, but more human trials are needed to confirm those results. Tips for a safe intermittent fasting experience. If you're curious about trying intermittent fasting, it's essential to ease into it. Start with a gentle approach like the 12-12 method, 12 hours of fasting, and 12 hours of eating before progressing to stricter protocols like 16-8. Stay hydrated throughout the fasting period with water, herbal tea, or black coffee. Avoid sugary drinks or those with artificial sweeteners, which can spike insulin and defeat the purpose of fasting. Break your fast with balanced, wholesome meals. Avoid the temptation to binge or overeat during your eating window. Focus on quality fresh vegetables, lean protein, fiber-rich foods, and healthy fats to keep you satisfied and nourished. If you feel lightheaded, dizzy, extremely fatigued, or irritable, it may be a sign that your body isn't adjusting well. Listen to your body and adjust the schedule as needed. Fasting should make you feel better, not worse. The verdict: is it safe? So, is intermittent fasting really safe? For most healthy adults, the answer is yes, especially when practiced sensibly and supported by a balanced diet. It can promote weight loss, improve insulin sensitivity, and even boost brain health. However, it's not a magic fix or universally suitable. People with certain health conditions or at risk for nutritional deficiencies should consult a professional before starting. Like any lifestyle change, intermittent fasting is only as effective as your ability to maintain it in a healthy, sustainable way. The safety lies in understanding your body's needs, watching for warning signs, and fueling yourself with intention during eating periods. If you found this breakdown helpful, explore more evidence-based wellness guides and balanced insights in our future content. Whether you're fasting, feasting, or just finding your rhythm, your health journey is yours to own. Stay informed, stay curious, and stay kind to your body.